Okay. Looks like we are live directly from Madrid. I'm speaking from my home, still in lockdown here in Spain. And we are back with our Coffee Break with Coachman, our podcast interview show where I have the pleasure and the honor to interview some of the most brilliant minds in our dental community. From the business, the marketing, the clinical, the technical, the systemic standpoint. And today we're going to cover a topic that I believe it's very, very cool, very, very important, and very, very relevant. Actually, I mentioned very cool, and we need to move from that phase that talking about these cool concepts are just cool and just really taking these things seriously. I mentioned last week, and I was very happy to actually see more people online talking about that. Of course, short term, to beat the virus, we need social distancing and we need to do the extreme measurements that we need to allow the health system to take care the best way possible of the ones that are in trouble with this virus. But long term, I believe that the only way to beat this virus and other viruses is to invest in your immune system, invest in your general health. That's the only way to move forward. So today, I have the pleasure and honor to interview Dr. Dominik Nischwitz from Germany, a well-known doctor specialized in functional medicine and biological dentistry, meaning he looks at the mouth in a different way. He looks beyond the mouth, and he works on something that I believe is the modern way of taking care of people, really looking at the whole. So welcome, Dominik. Thank you so much for accepting my invitation. I believe that the DSD community will really enjoy the topic, and I hope that we can plant some seeds in people's mind about how to make our patients healthier, not how to make our patients have a more beautiful smile only. That's the superficial side of dentistry, but also how to make people healthier. And because they are healthier, hopefully happier. And because they are happier, with a more beautiful, natural, confident smile. So thank you so much. Please give your initial hello to our community and already give us a little bit of a background on who is Dr. Dominik Nischwitz. Welcome.
Hi, Christian. Thank you very much for the nice words and for having me on your coffee break show. Very much a pleasure for me that the dental community will be interested in the more cooler advanced protocols. So I'm a specialist in biological dentistry, as you already said. Also go by the name Dr. Dom. I'm trained as a dentist, actually, normal studying, and also a naturopathic doctor, functional medicine doctor. You could call me basically a health enthusiast. And like you said, for me, it's like I'm looking at the mouth as the mirror for your overall health. And the concept of consequent biological dentistry that we are discussing is more like you already said, actually, it's the overlap of functional medicine, health optimization, or maybe biohacking, and what we all do, high-tech dentistry, which actually is, of course, aesthetic dentistry. This is actually how we met 10 years ago, Christian, like on a small, tiny little conference when DSD was not as big as it's now. And I just started. Can you remember? In Stuttgart. Yeah.
With Andres at Annex Dent.
Yeah. Exactly, at Annex Dent. And I actually, you were very nice to me because I probably asked you a few emails afterwards and how to grow. And this was when I was still interested in aesthetic dentistry. And this is basically also how everything started. So from a vanity point of view or aesthetic point of view, I started 20 years ago to get interested in bodybuilding, training, nutrition, just from a performance point of view. So I wanted to become a professional skateboarder back then. So I needed to jump higher. I also saw like muscular guys. I wanted to have ripped, shredded gains and abs and stuff. So initially I was looking at nutrition and all these things. mainly for aesthetics and performance. And this was before university as a civil servant. So at the same time, I went to university then and did everything with nutrition, health optimization to get me as healthy as possible, parallel to university, because the dental craftsmanship was always not a big thing for me. It was always, maybe I have a little bit of a talent here. So that went just sideways, and just was interested in all these things, but it didn't connect throughout university. So after university, I went straight to get my attendance or residency at a surgeon, a very skilled surgeon from Camlock Surgeries, because I wanted to do implant surgery right away and aesthetic dentistry, because I thought that's the cool thing. And this is actually how then everything got connected. All the studying I did for me and my own body in terms of how to improve health, what is the basis in nutrition, how the detoxification works. It basically again worked over the vanity and aesthetic point of view, because my boss back then was still doing the amalgam fillings. And I just thought it just ugly. I couldn't do black fillings. And I think nobody in your audience is doing amalgam fillings, I'm quite sure here. But still, it's 80% by the insurance, everybody does it. So I told him I won't do this. I will bring in ceramics and composites and all the things I learned in university. And this was the time when I had to really dig deeper in why I won't do amalgam fillings besides the aesthetic thing. And then I looked up on the internet, and YouTube just started back then. And I found legends in the field of functional medicine like Dietrich Klinghardt. And basically because of my own studying in terms of functional medicine, nutrition, supplements, now it all clicked, and it kind of got me, I would say, hooked or addicted to this whole topic. And this was the missing part for me, that I could actually, besides high-tech skill craftsmanship, which is very achievement-oriented, that I could help my patients getting overall healthy. And this is the fulfilling part now. And of course, this is 10, 15 years ago, and it's now a full concept that we all teach and train. So this is kind of like the background story and on how I got here now.
I always make, as I interview people, I always make, notes of cool comments and quotes. You already gave me a few very nice ones. You introduced your content to me before in off as health starts in your mouth. And we're going to go into that question. So leave that question for a little bit later. But you mentioned to me, I'm a health enthusiastic. I love this. It's just understanding as a doctor, moving from the practical procedures of fixing teeth into becoming a health enthusiastic. I think modern health providers, dentists or physicians should all become health enthusiastics, and starting with ourselves. You said health optimization, and I'm going to go back to this as well in a few minutes. What means health optimization, and how we can, some smart tips, some easy concepts that we can start following about health optimization. Again, the best way to beat this virus is health optimization, is not being away from the world, right? And becoming a dentist that cares about overall health. So let's start with you explaining the two titles in your bio here. You mentioned, if we go to your Instagram, very nice Instagram, by the way, we see Dr. Dom, and we see biological dentistry and functional medicine. If you can explain to us these two concepts, the definition of these two concepts.
Yeah, biological dentistry in a nutshell means it's just like we're looking, besides the reparation work, the aesthetic work, we look at the materials pretty closely. So we will always look from a medical point of view in what materials are we going to use, which materials are already placed in the patient's mouth. So from a biological point of view, we will always critically look at every metal in your mouth. Why? Because of toxicity reasons, because of immunological reasons, because of nowadays EMF problematics, like electromagnetic fields is a big topic. And every metal in your body, and most of them are installed in your mouth, can be an antenna, which distracts your whole autonomic nervous system. We will look at root canals from a biological medical point of view, not just from biting. So it's really the next level of just seeing, can you bite on it and do you look nice and aesthetic, to how is this all connected. So root canal treated tooth is basically, from a doctor point of view, functional medicine doctor point of view, is a dead organ, a tooth, and it's really an organ. There's 32 teeth connected to your trigeminal nerve, and one tooth is a classical organ. It has a blood supply, a lymph supply, an autonomic nervous system, meaning sympathetic nervous system, parasympathetic nervous system. And if you, for whatever reason, lose the tooth because of massive pain, you needed the root canal treatment to further bite on it. We remove, of course everybody knows, we remove the whole living organ from it, and we leave the tooth for biting reasons, but it's a dead organ. And if you look at it from an electron microscopic point of view, it has these dentin tubules per square millimeters. It's about 35 to 70,000 square millimeters of dentin tubules, which totally are the perfect cave for all the anaerobic bacteria, which are anyways living in your oral cavity. It's your full microbiome. And of course, if they live in there, they will be a chronic infection. If you have an immune system, all dentists know that if you have an immune system, the immune system will make chronic inflammation, raising cytokines like pro-inflammatory cytokines like TNF-alpha, interleukin-1 beta, IL-6, NF-kappa B, which leaves you in a pro-inflammatory state. And you might see it as a cyst underneath a tooth, which when you look at a cone beam scan, almost all, so at least 80% of all root canal treated teeth have one. So we have to look at this from a different point of view. And there's another topic which is not even covered yet in dental school, which is the term called, it's in layman's term, is called cavitations. Total wrong name, or you can find it under NICO. If you go into the medical literature, you will find it under CIBD, chronic ischemic bone disease, or the better terming would be FDOJ, which stands for fatty degenerative osteonecrotic jawbone. And this is a condition in the bone, can happen everywhere where you extract teeth without proper pre-treatment of the patients. And it's basically a chronic silent inflammation in your jawbone. All you guys that do implant drillings know if you drill in a bone where there was a previous tooth and you just fall kind of like into the bone, like hollow bone, it's most of the time a problem of healing and so-called cavitation. So this is a big thing. And that's why we look at the mouth from
for people to understand, because I want to go a little bit deeper into some of the major situations as you're describing, right? But before we go into situations, if you needed to define biological dentistry,
yes,
in one sentence, in one paragraph, how would you define biological dentistry?
Yeah, biological dentistry is the overlap of functional medicine, health optimization / biohacking.
So let's start with functional medicine. Let's first define functional medicine. If you can define functional medicine.
Functional medicine is it's a medical term. It's a train of thought in the US for real regular medical doctors, which I learned back in 2012, where you look at the body as an overall system. So it has a lot to do with how to really look at patient symptoms. Functional medicine doctors will do a lot of quantifications. By that I mean, we will look for blood work, a lot of blood work. And not just regular blood work, but just how to optimize it. There's a lot of diet or nutritional strategies involved to get the overall body healthy. We will look at the whole system in terms of immunology, toxicology, how to improve the body's detoxification, the whole organ system. It has a lot to do with inflammatory processes, how to reduce inflammation in your body by lifestyle changes, which includes, of course, your nutrition, going outside in nature, and coming back to a more natural approach. It's more kind of like being a doctor's detective, and you can already see what it involves. It involves a lot of time and talking to your patient to really figure out where is all these symptoms coming from in terms of chronic disease or disease at all, and how can we improve, where did it all start, and which tools and quantifications can we use. And one missing link actually in functional medicine is the oral cavity, because everything kind of seems to start at here, like health starts in your gut. But what is actually the entrance to your gut? It's your oral cavity. That's where you eat everything. That's where the saliva is. That's where a whole microbiome is. So basically,
let's go step by step here so people can follow us. Okay. We hopefully we will cover all, but let's go step by step. Functional medicine, from what you're saying, can I define functional medicine as something like a comprehensive vision as the body as a whole to optimize health in general?
Yes, yeah, perfect. And it's like the general medical approach for health is more like health is being absence of disease, whereas functional medicine looks not for disease but for health. So how can we improve health?
Prevention of health. It's a preventive approach for a better health optimization through a comprehensive vision of the things that are happening in the body and what they're causing in the body.
Yes, and in order to achieve this, we use different strategies in terms of quantifying things, looking at lab works, looking at the whole organ systems. You have to really know the code then. So the goal here would be so that we maybe understand it. So being a dentist is being a specialist. So I'm a specialist in ceramic implantations in aesthetic dentistry maybe. That means these techniques, I can do them, I can learn them, and then apply them. But that doesn't mean that I'm a good health optimization doctor. In my opinion, every doctor, a health coach, or a health enthusiast, or coach, whatever, should know how to improve the patient overall. So whatever it is, how to optimize your sleep, how to optimize digestion, how to optimize nutrition, lifestyle. Why? Because this is how your body heals and regenerates. And this is, of course, also very much interesting for us as just dentist specialists. Why? Because we maybe want to have perfectly osseointegrated implants. We maybe want to have perfect attached gingiva. We maybe have to just rebuild and regain things. So in my opinion, the next level of dentistry or the next level of medicine is that all doctors know how the whole body works. And then, of course, they do their specialty. So, of course, that's a technique that we are all showing. It's a technique you developed how to design a smile and then the lab work with it. But also, of course, it's a technique to know how the blueprint of a body's overall health works, kind of being like an architect for overall health. So it's just next level. It's nothing contrary to conventional dentistry. It's basically just more information, more knowledge, and you can apply all this with one focus, and this is our focus: optimal health. And of course, because I'm a dentist, health starts in your mouth, and actually it does, because this is where everything starts. Yeah, putting food in your.
So biological dentistry is just bringing these concepts from functional medicine into the mouth, as you said. For many reasons, medicine kinds of take care of the whole body but the mouth, right? So the mouth is kind of lost entity in medicine, and dentists are very well trained to fix the problems in the mouth, but not very well trained to see the connection between the mouth and the body. So if physicians are not experts in the mouth, and doctors are only expert and dentists are only expert what happens in the mouth, we have a big gap here that nobody's taking care of, or the biological dentists are wanting to take care and should take care. It is the connection between what happens in the mouth and what happens in the body. Is that correct?
I would say you perfectly summarized it, and I'm lucky that that's perfect. Yeah, exactly. That's how it is and how it works. So basically showing the medical field that the mouth is a part of the body is biological dentistry, and that we might need to look a little bit further than just repairing and aesthetics in how is it all connected. Because of course an endocrinologist, a doctor who cares about hormones, he will know that the hormones are going to be built in your brain, but they work everywhere in your body. But why shouldn't a mercury filling in your mouth, which is connected to your trigeminal nerve, not be in your body? And why is this so difficult for us to understand? Of course, it's history also, because we're not being medical doctors for 100 years now. We started as craftsmen, as dentistas.
Yeah. Now, you also mentioned something nice, becoming the architect of oral overall health. I love that, because it is like a project in life. You know, we do so many bad things to our own body that we need to become the architect of overall health, of our own health, or we need to hire somebody that is an architect, because we need to put a project together. We need to put a plan together on how to start removing intoxication from our body and inflammation from our body. And you mentioned that the good things you mentioned we need to improve the quality of sleep and digestion. I think these are two key aspects you mentioned. And you also mentioned the dark side, intoxication and inflammation. So
Yes.
talk a little bit about the importance of our work as a dentist on identifying quality of sleep and quality of digestion and controlling intoxication and inflammation.
From a biological dentist point of view, or just in general? Okay, in general, it's like when you want to, so the goal when every patient who comes to see us is either chronically sick or is a high performer, like an athlete or CEO or somebody like me who just wants to have a 10 out of 10 in terms of health and well-being. So I'm a guy who tracks everything for 20 years now. I'm doing all these things and lead by example. So for example, I'm wearing an Oura ring. Why is that? I like to quantify things. So if you're interested in sleep optimization, so you first need to know how is your sleep, because you basically just sleep. Maybe you wake up in the night, maybe you cannot fall asleep. So lots of your patients out there are not able to sleep. But why is this connected to you as a dentist? Because maybe your autonomic nervous system is in chronic sympathetic nervous system. That means it's in fight and flight. Yeah, it's on the gas pedal. Why? Because there's a lot of toxicity. Maybe your immune system is overreacting to materials. Maybe your immune system is intolerant to the root canals or the bacterial invasion in there. And this will activate internal things like the fight and flight response. Fight and flight is basically your sympathetic nervous system. You learned it in university and you have to know. But the problem is, if it's chronically activated, you can never relax and digest. So being in a stressed state could actually happen by having the mouth full of the wrong materials. Everybody is a little bit individual, so you cannot pinpoint every problem to just one amalgam filling. That's total bullshit. But you need to know that, for example, an amalgam filling is not just ugly, it's 50% of mercury. And from every point of science, mercury is the most toxic, non-radioactive element on Earth. Of course, you can bite on a mercury filling for years, but maybe you're chronically intoxicating your body. And maybe this patient has a bad lifestyle, cannot detox good. And detoxification is just something that your liver does on a daily basis, which is, again, it could be a genetical thing. Mostly it's just nutritional deficiencies. But then maybe because you have to detoxify, let's just go with the mercury on a daily basis. And it's just a vapor. It's not a particle of mercury that you swallow. It's just 2 to 3 micrograms per day of mercury vapor leach you out of a filling per day. And this vapor goes through everything, even through your gloves, it will go through your rubber dam, through whatever. So your body has to deal with this, and maybe it can compensate it for quite a while, but at one point, it will just fill up and fill up, combining this with other things that could stress you. So you have to know about how detoxification actually works.
Now, toxicity, I think it's a very important topic. We see more and more physicians talking about this. We're gonna mention a couple of things that we do as dentists that increase toxicity and don't help our patients. We know that our body is an amazing machine dealing with toxicity. We really take our body to the extreme, and our body is constantly working, trying to clean up the mess that we generate. But the problem is that we get to a point that the body starts not to be able to handle all the harm that we create to our own body. And that's when you start to have these chronic things that can really impact systemic health. Now, the other thing that you said, three things that I love. You talked about prevention, healing, and regeneration. I think these words are like music to my ears. It's like magic, you know. Prevention, So you treat the problem before the problem happens, or you treat yourself to avoid the problems, minimize the problem. Healing and regeneration. So as a dentist, as a biological dentist, what can you do to improve the prevention of systemic issues, help the healing process, and help regeneration?
Yeah.
As a dentist, what can you do?
This is basically what biological dentistry does. So we look at the overall picture. So whenever a patient comes in, we will have a panoramic x-ray and look at the full picture, not just, oh, does this tooth hurt, or is this filling defect, or do we need a veneer? We will look at everything. And then, yeah, it's kind of like an investment in your health, or like you said, it's prevention. And so it's kind of like investing in anything. You should start early and not come like when it's too late. So chronic disease is mostly preventable, and the good thing is 9 out of 10 things are lifestyle based. Toxicity is a big thing immunologically. So we will look at the full panoramic. We will look, are there any things that could be an immunological problem, could add up to the toxicity burden to your body, or maybe bring you in more sympathetic mode because of like just being connected to electromagnetic fields, like being in little antennas. So we'll check for metals, for root canals, and these cavitations. And we'll always make an overall planning. Of course, this includes the biting structure. Of course, it will later on includes aesthetics, because mostly aesthetics follows function. And function, you know, everybody knows that the bite is like where the whole body structure hangs onto it. And what we do is we start by preparing our patients. So we not just take anybody from the street and just perform surgery or do a ceramic implant or something like this. It's about optimizing the health. So they will start with lifestyle change by implementing a nutritional design, which is called food design concept. It's basically 20 years of my experience in terms of nutrition in a 10-pager. In my book, it's a little bit more, it's like 40 pages. Why? Because we want to activate the inner doctor, so to speak, so that your body is able to boost the immune system, to help and regenerate. This is also, of course, in COVID-19 times, that's the best thing you can do. Prevent, be as strong as possible, have no nutritional deficiencies, no micronutrient deficiencies like vitamin D3, vitamin C. There's lots of studies coming out, zinc, and all these things, because your immune system is there to attack invaders like viruses, parasites, fungi, etc. So, of course, we will pre-treat our patients with nutrition and micronutrition. So nutrition is macronutrients, protein, fats, carbohydrates, and micronutrients is the bone healing protocol. And then, of course, we will use everything that's there from the field of health optimization or biohacking. Just 1 second, health optimization is the word I like a little bit more. Biohacking is what the cool kids do. And I only know from biohacking about 1.5 years ago that I'm a big biohacker. And my good friend Tim Gray from England, he founded the Health Optimization Summit. And I was there last year, and I'm going to be the speaker this year. And this word really resonates with me, because this is what I do for me and for all my patients. Of course, by starting in your mouth, but with all the extra knowledge, of course, I can have the architecture or the code or the blueprint for the whole thing. So regeneration starts before the surgery and takes time after surgery. So kind of like building a new or remodeling a new house. The worst thing that can happen is having no workers there and having no building blocks. Same for your body. Having no protein or protein deficiency, or having a lack of vitamin D3 or vitamin C or magnesium. You cannot build bone. Your immune system will be worse, and you won't be as strong as you need to be nowadays. COVID, for example, but also not in order to really regenerate tissue and bone. So it's really just bringing all things together and making a full body concept out of this, which actually also improves everything for you in your dental office, because I only see about 1, maximum 2 patients a day, huge cases, big cases. There could always be the digital smile design being involved, because of course at the end the patient will have the perfect smile, of course, but we start deeper. We don't do it on a root canal tooth, because we look for optimization. And if the health is optimized, the patient will tell you, oh, Dr. Dom, I was seeing 29 dentists or doctors before. I had Lyme disease. I was chronically depressed. I had shoulder and neck pain. I couldn't sleep. This, and this. And now 80% of all my symptoms are gone. And at the side note, you also made nice teeth for me. So that's a total new perspective. And all patients actually wait for a long period to come and see me. And they are all very much looking forward to this. So I don't have any patient who comes and has to see the dentist like it's normally the case. Like, oh, I have to go to the dentist, maybe I have some pain, this and this and this. Of course, different for you guys when you just do aesthetic dentistry. It's more also plannable. But the general dentist, the conventional dentist, they see a lot of patients that don't want to see the dentist. And this is also negative for you as a practitioner. For my patients, they're not my fans, but they kind of like look forward to this experience, helping regeneration. And at the end, of course, we use the best mechanical, high-tech dentistry, aesthetics, ceramic implants, whatever you can find to, of course, optimize also biting and aesthetic looks, is for sure.
So, of course, the smile should be the consequence of a process of improving your overall health. And I understand that the concept makes of course total sense. You're seeing a new patient, somebody that you don't know, and the patient may have different complaints. The patient may say, I don't like my crooked teeth. Can you fix my crooked teeth? I don't like my smile. Can you do veneers? I'm not biting pretty well. Can you improve my bite? I'm missing some teeth. Can you put some teeth where I'm missing teeth? So these are the general complaints of patients. And we know that going to solve the problem that the patient thinks is the main problem, or just looking at the mouth to find out what needs to be done, you're not really seeing the big picture. So it makes total sense that theoretically, what you're saying is that every dentist, when we see a new patient, every dentist should do a deeper research about the overall health of every patient that we are about to treat. And maybe we will find out issues that will show us that we shouldn't just fix that little problem. We could help the patient in a much broader way, in a much deeper way, in a much better way. As you said, the patient will become a fan. The patient will not say, oh, I put a new teeth here. No, my overall health is much better, right? You mentioned a couple of the things. What are the issues, the systemic issues that you see the most that your work is helping people to overcome? You mentioned several. Let's just list. You said sleep disorder. You said, mention again the most common depression, you said, chronic pain,
yes,
postural pain. If you could list the most common things that your new skills are helping to solve beyond the mouth, not related to the mouth.
Yeah, so the usual suspects are chronic fatigue. That's a common one. Very crazy, but irritable bowel syndrome, like gut issues, is a big one that we see. Inflammation on the skin and in your body, joint problems, depression. Like, of course, if you have pain and something is off and you cannot concentrate, you don't sleep for the last 20 years, I would be depressed too. It's just being a state. And we now know from medical research, you just have to PubMed this, that every chronic inflammation with pro-inflammatory cytokines like TNF-alpha, interleukin-1 beta, IL-6 are 100% correlated and even sometimes causative for major depression. So if we have stuff in your mouth that is doing exactly this, of course it will be in your whole body system, because your tooth is not outside body, it's inside, and it's actually pretty close to your brain. So literally every symptom, from very intense, severe chronic diseases like neurological problems, Alzheimer's, Parkinson's, all these things, they're always connected to toxicity. Again, it's not just the tooth, it's the whole body concept. But you have to know that you as a dentist are not seeing something that you should approach. Like maybe the body is still intoxicated because of stuff being there for 30 years, 24/7.
What are the exams? What are the extra exams that every general dentist should add to their first appointment to get the information that they need to have this broader vision? What do you suggest? How do you suggest modifying the first appointment? What exams? What questionnaires? What extra exams?
Yes. So our first initial exam besides being remotely, at the moment it's being remote because so many patients are having inquiries for the last 3 years. So I couldn't see them in person anymore. Even if we're 4 doctors, it's not possible. So you will just send your panoramic x-ray and the medical questionnaire, which you can download on our website. And you will also send in, just as 2 critical markers, your cholesterol, blood cholesterol, to see an overall inflammatory thing, and your vitamin D3 levels. That's basically the very minimum. And then I will just make a full planning on email virtually. And then, of course, you will get everything that you can find from me, like all the videos. But when you're actually coming in to see me, we will do, of course, every dental examination for sure, like vitality tests, everything. We will, of course, do a panoramic x-ray. Probably if it's a new one, we only do a follow-up cone beam. Of course, we do a cone beam because we have to diagnose, is there any problems surrounding the root canal treated teeth? And can we actually do immediate implants? And of course, we will look for these cavitations. And those are not being diagnosed on a pan scan. Of course, I do a preliminary plan where I include them if I see that wisdom teeth have been removed, because in 99% of all cases, if wisdom teeth have been removed and you're not properly prepared with nutrition and micronutrients, your body won't be able to heal that in the back. So you probably end up having these cavitations. Silent inflammation, they don't hurt. And of course, I will preliminary treatment plan them with the plan. But of course, then we diagnose it. And then, of course, we will ask for nutrition, because I'm a specialist in nutrition and know all these mindsets. In my field, there are a lot of patients thinking that being a vegan, or it's now a trend, is a good idea. And it's maybe not. So I will just explain all my patients how to individually do their mindset correctly for optimal health. So I know exactly what to do if you want to be a vegan, but also regenerate and recover and heal and perform and not crash from the inside. I also know how to do that as a carnivore, which is the total opposite. So I know all the mindsets, ketogenic, paleo, whatever you want to call it. It's just experience and trying things and being very extreme in all these things. And then just individualize this. But this is something, in my opinion, so I normally gave a 2-day crash course seminar for all dentists to get started. It's just you need to learn the absolute basics, like immune system. How is the innate immune response working? What is macrophages? What is phagocytosis? And these critical pro-inflammatory cytokines. Because if you know these, you can look up everything connected to the oral problems. You just have to then look from the whole body picture. If you understand how the cytokines work, you can type in cytokine plus this, and this disease, like let's say TNF-alpha and multiple sclerosis, and you will find 3,000 papers. You can type in the Rantes cytokine, which is CCL5, plus CCL5 is a typical Rantes for the cavitations. It's super specific. And if this is high, it's pretty clear that you have a problem there. So you could do a blood work for this. And then you type in for Google Scholar or PubMed CCL5 or Rantes plus multiple sclerosis. You will find 1,000 references. But of course, this is not something you learn in university. It's something you have to really spend time and focus and really be interested. And I'm just providing 20 years or 15 years in maximum research and bring it down to what can we actually do to implement this strategy right away. So how can we remove metals easily without further intoxicating our patient, but more importantly, yourself. You're drilling out fillings on a daily basis, for example, and the dentist and the patient only has it once. So it's also, you just start by yourself. So you learn about immunologically, toxicology, nutrition. Then you have a lot of knowledge, and it's actually, you don't have to know as much as I do. So you can just go with the basics. And then, of course, you have to experience this on your body. In my opinion, that's the best, to then help your patient where he is at the moment. Because, of course, if you're a fat doctor who drinks sugar all day long, has metabolic syndrome, is insulin resistant, doesn't know about optimizing health, how could you trust this guy? So in my opinion, you have to practice what you preach. And then you can really help. And this is so fulfilling. Can you imagine how cool it is if patients really follow this, change their lifestyle, and actually stick to it? Because we made it easy now.
Can we drink wine at night? Is that fine?
Yeah, it depends on the dose. So concept, it's very interesting. The concept of longevity and how we actually, how that aging is actually a disease and how we prevent it. And there's a lot of studying going on in terms of longevity genes like sirtuins, and also this concept of hormesis. Hormesis is actually what doesn't kill you, make you stronger. And this is dose dependent. So one red wine in the evening, which contains resveratrol is known to activate sirtuin enzymes, which are longevity enzymes, could actually be beneficial. Whereas drinking a liter, like in lockdown, drinking 10 beers and a liter of wine at night is probably not a good idea, and too much. Ice cold baths, hot saunas, all these little strategies you can implement to optimize your own health on a daily basis.
Let's get into these cool, of course, this is a life of research and studying, and of course we cannot summarize this in a few minutes, in 1 hour, but yeah, let's go into some cool take-home messages. For example, if you have a patient that needs an extraction, a grafting procedure, and an implant, what are the things that you would be thinking on supplying this patient from this perspective to prepare them for a better outcome?
Yes, it all starts, as I'm a big believer in the food first concept. So everything starts with your nutrition, which you can change. And nutrition, to make it easy, I have the food design concept. I break it down into macronutrients, protein, carbohydrates, and fats, and I time macronutrients because everybody has a different mindset. So as I told you, vegan, paleo, ketogenic, carnivores, whatever. I don't care if you're plant-based or if you're animal-based, quality matters. And then you just focus on your macros. Number one priority to build your body and your tissue and your bone is protein, which is consisting of amino acids. So I will just write down to my patients 1.5 grams to 2 grams of protein / amino acids per day per kilogram, which will also activate and boost your immune system, which again in COVID-19 times is very important, but also for building tissue and also integration and also actually building teeth.
How much time before you to make an effect to have a...
So ideally, we always start at least 2 to 4 weeks at least. So if your vitamin D3 levels, so this is a critical marker we use. Vitamin D3 is the sun vitamin. Vitamin D3 is known to reabsorb or help with calcium and all the other minerals to bring them to the bone and to the teeth. So cavities are total sign of vitamin D3 deficiency. So if the vitamin D3, the norm is 30 to 60 nanograms per milliliter, and I want to have my patients on the day of surgery in the top range, let's say 60 to 70 nanograms. So if they send me the initial email and they're saying 30 nanograms, then we might need to start let's say 2 to 4 weeks prior to surgery. But a lot of my patients are already health optimizing. So they come in with 100 already. So you could start initially, and then I will individualize the nutrition as soon as I see them. And most of the time, a protein deficiency is the most deficient macronutrient overall. Why? Because we need to be anabolic at this time of life. Anabolic doesn't mean steroids or bodybuilding. It means building tissue, the opposite of catabolic. So healthy fats will be another one to focus on. And the food design is super simple. It's a green chart, macronutrients, protein, fats, and carbs. And the red chart is food intolerances, stuff that you should 100% avoid to not stress your immune system. This is super simple takeaway message for your listeners. No grains containing gluten at all. So I don't eat any grains at all. No sugar, it's a no-brainer as a dentist. No dairy besides butter. We don't do any dairy, like cow's milk dairy. And the biggest, in my opinion, is no refined vegetable oils, like highly refined canola oil or safflower oil, all the stuff you use for baking and cooking in these plastic bottles, which is yellow, which lasts for 1 million years, is refined vegetable oil. And this is so inflammatory. This in itself will lead to leaky gum and inflammation and lack of nutrients. Then, of course, D3 should be in the range. Vitamin C, I know you've been reading about COVID, everything probably, and you know that Wuhan did a lot of vitamin C IVs, and almost all the vitamin C was bought up by China. Why? Because vitamin C is a major antioxidant, and it's very much important against viruses, against infections, but also for you guys as just regular dentists. It is important as for collagenases to build tissue. Collagen is the structure within all your body for bone, for connective tissue. And scurvy, when the teeth are falling out, when you get periodontal issues, the disease that the guys on sea had when they didn't eat anything and didn't require a minimum of 10 milligrams of vitamin C a day, it gets loose. Why? Because the collagen dissolves without vitamin C. So immune system building up. Omega-3 fatty acids should be a thing to consider because they're anti-inflammatory, healthy fats, and everything that's antiviral, like you could do as a dentist. Oil pulling, you could recommend oil pulling to your audience. Oil pulling is just basically you take, for example, extra virgin coconut oil, you just put it in your mouth. It's coming from Ayurvedic medicine. You put it in your mouth, you leave it there for 5 minutes at least, and swish it around, and it will absorb all these fat-soluble toxins, and also is being antiviral, antimicrobial. Mainly the coconut oil, because coconut oil also contains lauric acid, which then turns to monolaurin, and monolaurin is super antiviral. You then HOCl, like hypochlorous acid, you could use to disinfect, you could use pea pollen and propolis. So that's the basics. But to make it easy, Chris, on my Instagram, like let's say within the last 4 weeks where there was COVID, I had an immune system boost summary. It's 5 slides. You can just swipe over. I can add you there, and you can maybe
asking here. So, what is your Instagram?
My Instagram name is Dr. Dom, DOME1, Dr. Dom1, and there you can find everything. Just scroll down. There's a lot of information and content out there.
A couple of questions here. How much? There's one asked how much. I think they probably the question is related to vitamin C.
Yes. How much?
Yeah.
So how I would first consider using a vitamin C that is not ascorbic acid, so it should be a buffered one because of the pH, obviously, also for your saliva. So sodium ascorbate is a good one, or ester C is a good one. And I would go at times of a little bit more immune stress, influenza season, COVID season, I would go with 2 to 5 grams per day, divided in multiple doses, just to make sure that you absorb it correctly. And SCC is very good absorbed.
Another question, what do you think about using ozone?
Oh, ozone is amazing. So we're using ozone for everything in our clinic. We have it as ozonated water for all our patients to rinse where the whole surgery is. So we have a machine that produces ozone from medical grade oxygen. So we used it for years to disinfect everything, like removing of a wisdom tooth. We will disinfect with ozone, gas, like 30 micron. We will disinfect the cavitations, the whole bone, when we remove root canal teeth. So ozone is amazing. Also from a functional medicine point of view, ozone, wherever you want to put it, it's anti-anaerobic, so it's really perfect. And it's maybe also a low-cost treatment against COVID. And they showed this already. It's a penny costing treatment. Type that in Google and PubMed, you will find a study for this. I showed that in the last 4 years.
Another one. How about the use of gingival probiotics for gum disease?
Yes, probiotics, amazing, big fan of it. You could start by just doing a little bit of like really sauerkraut juice, like fermented stuff, which contains probiotics, or you buy some probiotics. I would actually first start with the coconut oil pulling because it's antiviral, antimicrobial in itself. But adding in probiotics in whatever form is a good idea. But the microbiome always benefits if you change the structure. So if there's any toxins or metals or root canals in there, your oral microbiome is not healthy as it should be in a natural point of view because it's an unnatural state in your mouth. So
let's see, there's more here. Wait a second.
Yeah, just shoot.
No
problem.
Okay, no. One here. How do you, as a dentist, learn more about this and start implementing this? Where can people learn more? You already mentioned a good start is in your Instagram, definitely. But do you have places that you can learn?
Yeah, Instagram is very good for just overall content. I also show stuff that I do on a daily basis, just personally. On my webpage, there are all articles. I have a YouTube channel where I have a lot of short videos to explain all this. YouTube is probably a good one there. You can find lots of, also in English, like a lot of.
Your YouTube channel?
It's just my name. Dr. Dominik Nischwitz is my YouTube channel. It's super easy.
Another one. What is your opinion about Chlorella and Spirulina?
Big fan of Chlorella mainly, because Chlorella contains also chlorophyll, and chlorophyll is known to be activated by sunlight. I'm also a big fan of going out in the sun. And also Chlorella is a binder. In my opinion, one of the best binders because it's specific for heavy metals. What you shouldn't do is, if you still have metals in your mouth, only swallow it, don't bite it, because it will then connect with the stuff that's in your mouth. But in every good detoxification protocol, in my opinion, detoxification is a survival strategy nowadays. 10 years ago, it was totally different. But every day, the whole environment changes, and having binders on board like Chlorella, it's a good idea, but make sure that the quality is top-notch, because otherwise the Chlorella might be already full of environmental toxins, because it's actually the purpose, like be a sponge for environmental toxins in your colon, in your gut system.
Now another situation. Let's say a patient comes to you wanting 6 veneers, and everything looks kind of healthy, you know, gum is healthy, nothing visible. 6 veneers, the patient has several root canal treatments. What is your approach?
Yeah, first of all, the patients apply to be my patients now, so they know already that we are looking at root canals differently. So if these teeth, in my opinion, if he's coming for just aesthetics, and he wants new veneers or new partial crowns on like root canals underneath, I won't do it. So I'm sorry. If you're not interested in overall health optimization, there are so many other dentists that will do this. And we will see how your body reacts to those root canals. And yeah, it's totally dependent on where your patients are coming from right now. But you can maybe see that my clientele is quite extensive or extreme, and they know that I'm doing this, so I don't have to decide for everybody. Or actually, all my patients are decided before they even see me, because this is most important. It starts with them. They have to take the responsibility. It has to be their way. I don't do this for them.
Yeah. Now, let's say that the patient wants you to do what needs to be done, and he came to you because of that. And the patient has several root canals treated. What is your protocol on these cases?
Yeah, so like I said before, we will do an initial planning phase, which is all remotely. So you will send a panoramic, and I will plan on removing all root canal treated teeth, every single one of them, because I don't want to. So my focus is optimal health, and then I don't want to have anything that could be related to chronic inflammation or immune overreactivity or chronic stress or toxicity still being in your mouth, while I want to have another place in your mouth being healed. So imagine I just do 2 root canals, the premolars, but the 2 molars behind are still, I let them in there, being a root canal, being infected. So first of all, as I'm informed, there is general consensus in implantology that you shouldn't do an implant, rather being ceramics or titanium right next to a root canal treated tooth. I think that's not gold standard and should be considered. So, but from an overall healing point of view, if you know now that a root canal treated tooth could block your immune system or bring your body into sympathetic nervous system, that means chronic war zone, no healing. I cannot do just one thing and leave the other things for healing. This is kind of like harakiri. This is like not consequent and could make a big problem. So you could, of course, if the patient is super healthy, you could start with 1 quadrant and tell him about this and this if it's about a money issue. But if it's a patient who is super chronic sick, or he wants to be the best athlete on the world, then we do a 10 out of 10, meaning I remove all chronic oral interference. So I remove the full sources and, of course, install, if possible, a biocompatible alternative. But first of all, clean everything, make everything as healthy as possible. The focus is not on implants, not on the biting, and not on the aesthetics. It's first on how to improve the health as much as possible. If the patient is somewhere in the middle and we can play around, we could also go with maybe a quadrant. But this is maybe when we teach, so for biological dentistry, we teach that at least one quadrant, can you say that in English? It's like one, we have quadrants in Germany, one quadrant, let's say upper left. We start with this because this is a top priority, and in terms of money, we cannot afford more at this point. So we will help by at least doing this side fully. No root canals, no cavitations, no metals at all. And then we will see how we can optimize the structure. But from the other point of view, just is, if it's an investment in your health, how much does it actually cost you to leave, for example, mercury or anything toxic in your body in this environment where it's actually so much more difficult and unnatural for you to strive and not just survive? So it's really changing big time on a daily basis. And for example, with COVID, something totally different, but you have a 10 times higher risk to get any sort of COVID or influenza if you're insulin resistant or have a metabolic syndrome, which means you have too much body fat, too much inflammation in your body. So having inflammation in your mouth is quite the same and adds on top of this. So just look at this and I hope this is a thing that comes out of this lockdown, that patients are starting to take responsibility for their lives and for their overall health and invest in their overall health. And maybe we as dentists just see that we have a big part and that we kind of like the key in between integrative medicine and chronic disease by seeing that we have problems to address and also show this to other doctors.
And let me make notes of that. Can you repeat that? The dentist plays a key role on the connection
between integrative medicine and chronic disease, because the mouth is the entrance to your body and is the mirror for overall health. And as a dentist, if you trained a little bit further than just from a university, which is the entrance card, and you apply immunology, toxicology, etc., you can see inflammation, you can see toxicity, you can smell. All you dentists in here know how a nasty oral microbiome with lots of, you know what I mean, it smells nasty, it smells rotten, and you know that this is maybe just the entrance to the whole body, and these patients don't present healthy.
Let me repeat this. Dentistry plays a key role linking integrative medicine and chronic disease. Dentistry plays a key role linking integrative medicine to chronic disease. I love that. I love that. Yeah. This is very powerful. Now, if the final question here, if you have a patient with general periodontal disease, what suggestions to prepare this patient before a surgery or before a treatment?
Yeah, same system here. So actually we have to take care about the oral microbiome. We will start with, again, the lifestyle, because periodontitis is known to be like one cause or one correlation is with a lot of chronic stress in the body, depletion of nutrients, depletion of micronutrients, chronic stress, lack of everything, maybe smoking, and also diabetes, insulin resistance. So we, of course, change their lifestyle. Then we take care of everything that could disrupt the oral microbiome. So we will take out all metals for sure, and then put them just on temporaries, long-term temporaries, whatever. You all guys know that if you remove one metal crown and you insert just one ceramic zirconia crown, within 2 weeks, the tissue that was before bloody and violet and inflamed will be healthy. Because this is just general consensus that we know also from titanium implants. If you use ceramic abutments, that tissue will grow on top of ceramic, because ceramics and tissue love each other. That's really important, because if you have inflammation in your gum, and your gum is not attached and not healthy, you get an opening, and this is really, really important. You get an opening to your inner system, kind of like, maybe you heard of it, the leaky gut. The leaky gut is a leaky endothelium in your gut system. Imagine leaky gum, which all of your dental patients have, because there's still a little bit of bleeding, or they're using dental floss. You have an opening for anaerobics into your periodontium, into your system, which is inside body. So of course we will take care of the microbiome by removing all the garbage, and then supplying the right nutrients to heal and regenerate. Of course, maybe if you have subgingival plaque or like calculus, of course we will remove this, but we don't do open flap surgeries because what is the name in English? Granulomatous tissue, like the stuff we remove, is actually your body not being decided, is it going to be bone again or is it going to be inflammation again? You can still decide. Yeah, granuloma could become bone again. Yeah, not a cyst, but granuloma, and sometimes periodontitis is it. So by just supplying protein, healthy nutrition, vitamin D3, vitamin C, all the stuff I just summarized for immunology, your body will be becoming less of a high responder. If you then take out the toxins that might be activating and overactivating or your immune system to be in stress state, you will then also have no problem with periodontitis. And also, of course, not with...
Help me here put a little map together, okay?
Yes.
If I understood properly. When the patient comes, the first step, of course, is take care of emergencies, clean up the area, right? Remove whatever in the mouth is making things become even worse. Yes. You mentioned the endo treatments or metals or not biocompatible materials and so on. And even if you need to put the patients in long-term provisionals, but just clean the area and yes. remove everything that is making the situation worse, right? The second thing you mentioned after that was to make a deeper research about lifestyle and systemic health. Actually, giving some instructions, at least for the person to improve their lifestyle, to prepare for a big surgery or prepare for a major procedure, right? So you want to give some instructions to strengthen the person overall to go over that specific procedure. Then you said, go ahead.
We actually do that with every patient to improve lifestyle and nutrition and micronutrients, because this is just basics. This is kind of like the cake, not the icing. This is just basic fundamental building. So this is always good to do that. As any doctor, you should start by changing the lifestyle, because chronic disease, 9 out of 10 cases of chronic disease are lifestyle. 41% of all our patients out there, which you don't listen to in the media, are dying from obesity and correlation in terms of heart attacks, strokes. And just check the WHO, the 10 causes of death. The number one is always heart, and strokes and all these things. And those are basically lifestyle factors. So you can take responsibility and make that go away within actually a super fast time if you just change your lifestyle. So this is always included in our treatment. And basically, because our patient and periodontitis is not an emergency treatment, it's mostly a chronic thing that's going on for years. So if they see you can initially give them an information sheet about the nutrition, they can do that on the next day. Start by going to the doctor and do the vitamin D3 measurements and start eating according to nature and skip the processed foods and all the no-nos that I just mentioned, like the grains, the sugar and stuff. And already this, by using the right macronutrients, proteins, healthy fats, and the right micronutrients, vitamin D3, vitamin C, vitamin K, magnesium, etc., you will already improve the immune system and the aggressiveness, and also improve regeneration and recovery. And then, of course, you take care with the next appointment of the oral environment, which may be super unnatural. And of course, then your immune system will be in a stress mode and maybe do periodontitis. You all notice that a lot of times patients have one root canal with a huge periodontal pocket and everything else seems to be good. So it's a no-brainer that this might be a stressor for your immune system, which makes the chronic inflammation, which then leads to overactivation, cytokines, and then overactivation of enzymes like MMP8, which then, of course, activate osteoclasts to affect the bone, right?
Can we say that chronic inflammation is probably the biggest enemy of our health?
Yes, chronic inflammation and everything that goes along with it, like chronic inflammation, insulin resistance. This is probably it goes hand in hand, and toxicity and being in an unnatural environment, and making that possible. Within 100 years, we made it possible to totally go away from what we are as humans in terms of being natural, because it's not natural to live in crowded cities, having EMF everywhere, like just for convenient reasons, not going out in nature anymore, sitting inside in front of a computer, all these things. I am a big fan of technique, and I'm a big fan of social media, and that we're now able to provide information and make it fast, but you have to be smart, use it smart. So I have everything, when we not talk, like everything is in flight mode. So my iPhone, everything that I have, I don't have Wi-Fi at home. It's all here connected. I have old school cables, even my mouse. Of course, Bluetooth mouse is nice, but I know my knowledge. There are good books. I do that for years and years and years, and you can find out about electromagnetic fields. And now imagine any metal in your mouth or any metal in your body is in this environment where you have electromagnetic fields, Wi-Fi, 3G, 4G, soon to be 5G everywhere. It's not woo-woo, it's not woo-za. Since 2019, electromagnetic fields are cancerogenic. So if you have metals in your mouth, of course, you amplify this. There are studies showing, dental studies, that if you have a mercury filling and you do a phone call, normally the electromagnetic waves go from the cell tower to the phone and back. If you have any metal here, it will amplify. If you actually have mercury fillings here, you have more vapor going out. Old study, can send you in a second if you want. So there are studies. Just look at it and don't believe everything that you just listen to in media. Just be smart about it. And then, of course, you don't have Wi-Fi at home. And at least at night, you have this one at flight mode. And if you have metal in your mouth, you could be electrosensitive. And this is a big thing for a lot of people out there that are chronic sick. So you have a huge thing you can do, besides the awesome thing to make nice aesthetics, at the same time making patients healthy, better. And then if you're healthy, you're also aesthetic, right? You look better, you have nicer skin, you have fun, you go out and motivate and inspire other people. That's just amazing. It's fulfilling.
I think, there's, of course, some of these topics are very controversial, and regular dentistry is always kind of ignoring many of these topics. I saw a couple of discussions online, people getting angry with some of these conclusions. I have a very open mind, and I'm very actually lucky to have on my father a great example of a excellent dentist, that his number one behavior is being humble and understanding how much you don't know. Hard to see what you don't know, and understand that the body is so complex, and there's so much we don't know about the body, that is very arrogant for us to look at dentistry, the traditional dentistry, and say, oh, this is not scientifically proven. Oh, we've been doing this like this for 3 decades. Oh, we don't have enough evidence. At least we need to be humble to understand that maybe the conventional medicine and conventional dentistry is not convinced yet. And I believe that conventional medicine and dentistry is playing their role in terms of forcing new ideas to be proven by science, but to deny the fact that 90% of the problems that people have in their bodies, medicine and dentistry have no clue why these problems are happening and what are the connections between the problems. And once you activate this humble mode, this beginner's mind, instead of I'm the master, I'm an expert, I don't listen because I'm already very comfortable with my know-how, I believe the only way to actually move and improve is by opening our mind to these new ideas. I strongly believe that the future will show that many of the things that you're talking will become common sense in the next few years, in the next decade. Like history. History has proven that things that people were talking 1,000 years ago and were considered crazy people now are reality. And since then, we see science proving being wrong over and over and over again. So I hope that more and more dentists, my father, as I said, is completely open-minded and it's completely into holistic care, comprehensive care, biological dentistry. My uncle, I don't know if you know, but my uncle is a dentist, and one of the top experts on biological dentistry in Brazil. By the way, you guys should connect, because his whole office is about systemic care. His office has all kinds of physicians working together, and the dentistry is just a part of it. And he uses all the tools that you were mentioning. So I'm very familiar. I'm not an expert, but I'm very familiar to be around people with an open mind and understanding that the human body needs a much more broader approach. So I'm very happy to actually listen to you talking here, Dom, and giving your insights. And I hope that more and more we can bring your knowledge to our community and see how people can start to provide these type of more comprehensive care to their patients.
Yes, because it's just next step. And like you said, just have to be open-minded. And you can imagine how much critics I always get, and also wrote the book, It's All in Your Mouth, for the layman. And yeah, I'm just doing it consequent. And ever since last year, it's the first year that all my friends from university, which always, one of my best friends actually, always said, nah, go away with that bullshit that you're talking about. He is my biggest fan now. He's doing biological dentistry. He told me, Dom, I cannot believe how I couldn't see that I could help my patient overall. And he's an early adopter, not like me, like doing this and inventing it for 15 years, but he's an early adopter. And when he comes, it's becoming mainstream. I'm so lucky that all the cool kids, like you said at the beginning, the biohackers, the health optimizers, are coming now actually and starting to follow, because basically there is so much evidence and so much science. Even if there wouldn't be any evidence or science, there's empiry, and always empiry is first. Yeah, who heals always wins. And you know, like everything needs to go to phases, like Gandhi said. And at the end, like you said, probably in 5 years or so, or I think maybe even faster. I think now is the time that people look at health optimization and actually starting in your mouth. And the cool kids will come and use all this, because it's just not contrary. It's just being open-minded and becoming, somebody who can help your people. And my dad is a dentist too, and he's super open-minded. He's doing the clinic with me. So if we all connect, I call all the open-minded doctors wolves. So I'm forming a wolf pack out there and spread the knowledge as much as I can, do the public relations, and invest my time to just spread information, because it's just not about me, not at all. You can maybe feel that I'm inspiring, or that I'm really passionate about all these things, because I learned that for myself. I had to improve my health first, and now I can give it back. And this is where the true fun is. And everybody who's not open-minded, it's their problem.
No, you said a great sentence here, great phrase to end. Who heals always wins. Yeah, it's don't fool yourself with this short-minded, closed-sighted vision of I need to see the science above all proving anything. You need to have science-proved, scientifically based information, but always keep a little space on your mind for things that are not maybe that common and that used and that proven yet, because these are the things that will make the difference in the near future. Because if we stay with only what is proven or normal, you know, we don't improve the whole process, right? So I love this. I really love this. And Dominik, thank you so much for chatting. And just a final message to our community, a good final positive message for everybody that is listening to us.
Yeah, just be open-minded, read about all these things. Just start with yourself by investing into your health and having your bio age yourself between 25 and 30 for your whole lifetime. Maybe you can become 120, 130 without getting any disease, because you have the relationship, you have the responsibility. It's your life, and you can also actually help and heal patients, and doing amazing aesthetic work and high-tech dentistry. So it's an overlap, the biological dentistry of functional medicine, biohacking, health optimization, and everything to the goal, which is being optimal health for everybody out there. And thank you very much.
Fantastic. Thank you. We hopefully
shout out to Miguel, because he connected us.
Yes. Miguel reconnected us after 10 years ago that we connected for the first time. Miguel was the one connecting us again. So always Miguel opening doors and for me and helping me out.
And one more, yeah, if you're interested in all this field of health optimization, check out the Health Optimization Summit Momentum Grace doing in London. It's amazing. All the wolves from all the different areas will come there and explain the overall concepts.
Health Optimization Congress.
Summit. Like Summit. It's like a big conference. It's in September and it's going to be in London. And the best experts in all fields, functional medicine and biohacking, health optimization, mind tuning, whatever, it's there to help improve your life. It's legendary. So that's something I would add in if you want to see this.
Fantastic. Hope everybody that was watching enjoyed. This interview will stay on our Facebook and on our YouTube, so you can watch on demand. So if you enjoyed this, tell your friends, tell them to come and watch. I think this topic is a super hot topic. It's a great opportunity for dentists to get out of this crisis, providing a new offering, providing a new opportunity, providing better health for your patients. See you on the next interview. Thank you, guys. Thank you, Dom. Stay in touch, my friend.
Lots of love. Stay in touch. Cheers.
Ciao.